I wanted to start out and kind of ask you the question of like, what do you think is going to be the biggest change in the next coming year?
Well, Ben, as you know, I work with providers and governments around the world. And it doesn't matter what country that I'm working in, everybody's facing similar problems. They have an aging population that has a growing number of chronic conditions. This is putting pressure on the healthcare systems, and access is becoming an issue. And nobody can sustain the current cost trajectory that they're on. And so governments and payers around the world are asking providers to not only increase quality, but today focusing on doing that at a much lower cost. And to be able to make this change, people around the world are coming to similar conclusions that we're going to have to transform the way we provide care. We can't wait for a patient to show up at our door, diagnose their problem, come up with a plan of care, fix them, and send them on their way. We're going to have to start to proactively and predictively manage populations no matter where they are: the home, the doctor's office, the home, rehab, post-acute. And in order to do this, I think we're going to see a handful of changes in 2015. The first one being, an even greater focus on openness and interoperability and data exchange. If you want to manage this patient no matter where they are, you have to have access to all of the information about their, not only the care they're provided, but their health as well. And so focusing on interoperability so you can aggregate that data to do the other area of big change that I think we're going to see in 2015 is a greater focus on analytics so that you can understand these populations. And as you can risk stratify these patients, you'll move into the other area of change I see, which is the care coordination, coming up with a plan of care that works across the entire community, no matter where the patient is. And I'd say the last area of change, and probably the biggest area of change that I foresee in 2015, is bigger focus on patient engagement. You could have the best protocols, you could have the best providers, you could have the best evidence. If we can't get patients to change their behavior, we're not going to be able to meaningfully move the cost meter. And I think, as you know, only 10 to 15% of your health status is really dependent on the care or service you are provided as a patient. The majority of it has to do with your behavior, genetics, and socioeconomic factors.
There seems to be, with technology and data, there's a little bit more information for the consumer to be able to end up sort of change their choices and change their behaviors. Do you see that continuing? Do you see that happening?
I think big data is going to play a huge role in engaging patients more. As we're able to aggregate more data from across the community and run analytics on it, that's going to provide people with information at the point of care at the hospital or in the home about choices they need to make, and data that is evidence-based and personalized to their condition and where they are.
What do you think needs to happen for interoperability to sort of really kind of, become sort of the mainstream and become something that happens across both all providers, whether it's from the consumer to the healthcare provider to the pharmaceutical companies?
I think a lot of it is already started, or at least the beginning of it, with the government and meaningful use forcing people to share information. This has prompted a lot of the vendors that are out there to rethink their strategy about being closed and being more open. This has prompted healthcare systems to rethink their strategy and be more open with their information. And so I think to really make it happen, you're going to need technology similar to what we have at Allscripts with the DB Motion technology, that is something that allows information to be exchanged independent of the electronic medical record system that's lying underneath it, whether that be in the post-acute, the hospital, the doctor's office.
With electronic medical records, the government's been sort of promoting it with incentives to providers and to sort of push it forward. Where do you see EMRs going this year, and where do you see in the near future?
I think we're finally starting to hit that tipping point. I mean, at a minimum, everybody recognizes the value of it. We're starting to see more and more research on the benefits of it. I think I just read an article that talked about a 17% drop in adverse drug events that can be attributed to electronic medical records. So the evidence is coming through, and with younger and younger clinicians coming out of school, having grown up with technology, I anticipate that we're going to start to close the remaining gap, the last mile of people that need to implement electronic medical records.
In terms of the big challenges that are out there in the healthcare space, what do you see as one of the biggest challenges right now in terms of hurdles to overcome for this year?
This is a seismic shift the industry is going through worldwide as we change the way we provide care, as we talked about earlier, moving away from fee-for-service care and managing individuals in a specific setting of care and moving towards managing populations. And change is tough. Any kind of change is tough, and this is seismic change. And I think one of the greatest obstacles is going to be you're going to have doctors and clinicians broadly that need to make this transition from the way they were operating before to the way that people need to operate together in a more collaborative environment across the whole community. And I think technology is going to be an enabler of that with the data aggregation and interoperability, but it's also going to still continue to be one of the biggest challenges in 2015 to make sure that that data flows seamlessly across the community and that the data is liquefied.
You see now all of a sudden the speed of different clinical outcomes and the speed of different types of care happening because of this data exchange?
I think there's a lot of brilliant clinicians out there, very dedicated clinicians out there, and when people come up with new ideas, getting it from research to the bedside can take a long time. As people have more and more electronic records implemented, and as they're able to communicate more with one another, it's much easier when you come up with some evidence that works to promote that widely to not only clinicians within your facility, but across facilities. So absolutely, electronic medical records and interoperability are going to advance and reduce the time it takes to get from research to the bedside.
In terms of issues you think are flying under the radar right now, what do you think in healthcare isn't getting the most attention?
When we talked about big changes in 2015, I said care coordination is going to be one of them. And there are some advancements in that space, but I still think it's not getting enough attention. I mean, coming up with new models and new positions that haven't existed traditionally in certain facilities and care settings of a person that, outside of the physician that's responsible for not only managing the care you're getting provided, but managing your health proactively is going to be critical to making this transition we're talking about. So I think, we need more focus on care coordination and setting up policies and the people and the tools to make that happen. And right along with that, I think the other area that's been, not getting necessarily enough attention, has been flying a little bit under the radar, is personalized medicine. While these care coordinators are going to be responsible for populations, when those plan of care get put together that operate across the whole community, it still has to be very personalized. And as our understanding of the genome becomes even greater, how we take that information and tailor that plan of care to your specific genetics, your specific condition, your specific socioeconomic environment is going to be critical in the future. So I think seeing some more attention paid to care coordination and personalized medicine will help accelerate some of the change that we talked about.